is an issue of interest to me. Several of us represent medically underserved areas of the state. Significant shortages of physicians today, projected to be even more significant in the future. And while we add a medical school here or there, and some are public and some are not, simply graduating MDs is not going to solve our healthcare crisis, because an MD essentially cannot practice without a residency. As you know, most residencies are funded through the Medicare program federally, which is not expanded in quite some amount of time. And in fact, there's talk of reducing those dollars. And number one. And number two, the medical residencies are not geographically dispersed in the best possible way. Many of them are on the East Coast and fewer on the West Coast. So if we have any hope of solving our health care, and I know we have a doctor on the dais here, but if we have any hope of solving our health care crisis in California, we are going to have to expand residency programs, and in particular, expand residency programs on the West Coast and in California in particular, and in the medically underserved areas even in more particularity. Now, it occurs to me that when we were here last year at the end of this process, if I understand this correctly, we had negotiated $100 million over 3 years for medical residencies, and we had the $50 million going to UC for medical residency programs, for a total of $250 million in medical residency dollars over 3 years. Is that correct?
I'm speaking to the UC issue. The UC augmentation that the Assembly proposes would be ongoing, so that's what's being reflected there.
But I'm talking about last year.
Yeah, last year.
As of the end of the budget process last year, we had negotiated $100 million over 3 years, right, which the governor agreed to.
For the Song Brown program.
And UC to Song Brown, and UC was receiving $50 million, correct, in general fund?
I'm afraid I'm not.
Yes. To clarify, Senator Roth, you're absolutely correct. In the Budget Act, in the current year Budget Act, there was $33.3 million annually over 3 years through the OSHPD item. And then in the University of California budget, there's a $50 million as part of their base for this purpose.
So fast forward from the end of last year to present, under the proposed compromise, we will have a significant reduction overall in medical residency dollars. And of course, under the Senate proposal, it's even more significant. We're going in the wrong direction, I guess, is my comment. And that's not counting the Prop 56 $50 million.
Yes, Mr. Rombula.
I've been staying quiet for most of the day, but I couldn't help myself on this, and we're getting into my subject area. You know, I'll tell you, I struggled a bit working in the private sector to be able to recruit and retain physicians. And part of that, I believe, is a lack of public spending from our state into training physicians of tomorrow. And believe that both because of the silver tsunami that's coming, the aging provider population, that we must do more as a state to make sure that we're training physicians, particularly when you look at regions that are falling behind, that struggle to train within their communities. I know Senator Roth struggles in his area, as do I. And so would look to make sure that the governor honors what happened last year. I understand that budgets do change, but it was a big priority of many of us last year and will remain one for us going forward.